I had to pause because my baby wants to be fed. So here. So yeah, transport can cause a delay in care, and any delay in care could cause worse outcomes. Anyway, I was just very against the idea of transporting, and what if my baby needs to be intubated and needs a neonatologist and there's none available? So I got really talked out of having the baby at home because I was just afraid of everything going wrong because of nurse curse and my bad luck in general. So I decided, I'll have a baby at a level 1 trauma center with a level 4 NICU, and everything should be fine then. Because I'm strong and I know how to advocate for myself and and I understand birth and I understand the medical side of it. So it's like I should be good at advocating for myself. Of course, I was naively assuming that because my baby was head down, it'd be straightforward. And it wasn't, because she was OP, I guess. And also, I didn't expect that my water would break first thing. I was even taking collagen throughout pregnancy and liver, and I was eating animal liver. I raised meat rabbits and had their liver for pregnancy health because I really wanted to give myself the best chance at birthing naturally and having everything go smoothly. So I decided against doing a birth center birth. And I had my baby in a hospital. And the ironic thing is I ended up hemorrhaging. My worst fear was, I might have hemorrhage. And that happened to me. And I was there begging for blood for 2.5 hours. Literally saying, please give me blood. Please give me blood. Just like that. And they wouldn't listen. They were like, no, we're going to wait for labs to come back and see how bad your bleeding actually is. Because they didn't believe my blood pressure, I guess. Because I was so alert. I was so angry. And I was so alert. And they just were like, oh, she's not really as bad off as her blood pressure showing, I guess. So, anyway, they should have ordered a mass transfusion just based on symptoms and blood pressure alone. But they didn't. And then when my lab showed that I was indeed hemorrhaging to death, they were still not willing to get a mass transfusion. And the rapid response team that showed up, they questioned the OB and they were like, you want to get a mass transfusion going? And she's like, no. We got 2 units coming. 2 measly units. So I got that very slow to gravity. No warmer. I already said that in another video. And on the way to the OR, they bumped me into everything imaginable with the stretcher. And when you're close to death, every little thing makes you really nauseous and can cause a vagal response. So I was so angry at them for bumping me into stuff. I'm like, when I'm flight nursing and I have a stretcher with a more complicated patient with a lot more devices and stuff on board, I do not bump them into everything on the way to the next room. How unprofessional. And they were just giggling, where I was like, do you want me to get off and drive? Which again, doesn't sound like I'm dying when I'm saying stuff like that, but I was so unbelievably angry at the lack of consideration for me as I was dying. They just kept acting like I couldn't possibly be dying, It was just crazy. And then day shift rapid response took over, and of course they had no idea what had happened previously. And they stepped up and protected my life, and they saw I was still hemorrhaging after the Jada placement, because that same OB put a Jada in me and then left and thought that she cured me, fixed me, whatever. And then it wasn't until day shift rapid response showed up, and they're like, oh, actually, she's hemorrhaging still quite a lot. So, yeah. And she also, when she placed the Jada, she took it out after initially placing it and removed a bunch of clots manually and then put it back in. So that's not how you're supposed to use a Jada. So one of those times is when she perforated my uterus. Can't really get anything done because baby keeps wanting to be right next to me. I'm trying not to put her in the video. But what? Okay, I fed the baby, so she should be happy for a minute. Yeah, I don't know what I was saying initially, but there's reasons why I wanted to have a hospital birth related to like the things I've seen and the worries I had. And then, you know, all the advantages of having a hospital there, you know, blood products and an OR, really harmed me. And I didn't get blood products quickly. So, in my opinion now, it's like, go ahead and have a home birth. You know, be close to a hospital in case things go wrong. But to say that you're safe at a hospital is totally not true. It just depends on who's working. You know, if I would have had a great OB who could have manually rotated my baby and gotten her out vaginally, I would totally say other things. But, or even if she could just do a C-section correctly and place a JETA correctly and give blood correctly, I would have a totally different opinion. But because none of those things happened, and, you know, staff member after staff member was basically gaslighting me and trying to make me think that, oh, everybody who touched you was trying to help you, when I know that's not true. You know, now my opinion is different. So, but this book that I'm reading, Birth by Tina Cassidy, talks about the history of birth and how, you know, obstetrics was founded kind of in a pursuit to take birthing away from midwives and women on their own in their houses and pull it into theater and kind of sterilize it and medicalize it and all that stuff. And it's kind of religious based too. A lot of like issues with obstetrics in history has to do with religion, like wanting to maintain modesty around a male, and the idea that midwives were kind of seen as witches at the time, and trying to take too much glory from God and having a successful birth. So then obstetrics was founded, and there's a lot of like interesting anatomic drawings in early obstetrics, and they think that some of the women they found to do these autopsies on and draw these pictures, they were probably killed so that they could be slaughtered and studied and stuff. And then it also talked about how prostitutes, they weren't seen as like human really, so there wasn't as much of a push to get those women into hospitals to birth because they're just dirty prostitutes, so who cares what happens to them. And they actually had better outcomes than the women that were going to birth in hospitals with obstetric doctors. So there's always been this push to stay away from home birth, stay away from midwives, and go with a safe doctor in a hospital. And throughout history, we've found that there's a lot of harm that obstetric doctors have caused women. And they always end up blaming the woman for whatever problem happens. Like, if you have a really hard labor, oh, you must not really want your child, or you must have sinned, or you must have done something against your husband. Yeah. And even nowadays, it's like women who have higher education, especially healthcare workers, they usually have harder times in labor. There's like the whole nurse curse. And that could be, oh, you can't get out of your head enough in order to have a physiologic birth. And I don't know. That could be true. I was in my head a lot trying to birth my baby vaginally. I have a lot of guilt over getting an epidural. I think that moment is really what sealed my fate for having a prolonged pushing phase, which ultimately led to C-section. And there is a correlation between epidural use and a baby that won't turn and remains posterior. So it's like, well, did my epidural cause my baby to be posterior, or was my posterior baby causing me all that pain that led me to need an epidural? I don't know. So I do know that the epidural prevented me from getting into hands and knees and controlling my own positioning. It shouldn't have, because nurses are able to position you with pillows and get you into hands and knees position. And those obstetric beds, different sections of it can move so that you really don't have to rely on the woman's strength at all to get her into these positions. So I'm really angry over my nursing staff. I had 2 nurses for the price of 1, they said. Always, if they say 2 for the price of 1, that's a setup. So I had 1 in training, and the other one was really useless, just sitting on her butt the whole time talking to the other one. So they wouldn't let me rest, and they wouldn't position me differently. And even though the one who was training the other was like scoffing at the doctor for saying C-section should happen for an OP labor, she's like, women have OP babies all the time. And I had friends who had OP babies. She did nothing to actually help me birth my child. So, yeah. And in the natural community, you know, this book I'm talking about, Birth, the History of Birth, she says the majority of people who are still attracted to home birthing is religious women, because they want to still keep it in the home, and I don't know, maybe modesty is also at play there, and some other things. And that God, like, made you capable of birthing your own child, so there's no real need to have Western medicine involved. But I don't know. The natural community is kind of damaging to women like me who ended up with a C-section because they kind of have like the old beliefs where, oh, you must not have tried hard enough. It must be your fault. You must have done something to make your birth more painful or cause your baby to be OP. I don't know. I know that I did a lot throughout my pregnancy to be very active and work out. And I did, the baby keeps trying to be in the camera and I'm trying not to put her in the camera. I did a lot to prevent malposition in my baby. I did mile circuits in my pregnancy and stuff. So I don't think it's something I did. She was always kind of on the right side. My uterus was always kind of balled up on the right side whenever I'd have Braxton Hicks. So maybe her head was kind of lodged there for a long time. I don't know. Sometimes if I would lay a certain way for a really long time, I could feel her shift. But that was pretty rare. It was like most of the time she'd be on the right side. Nobody ever told me she was OP. Like, nobody scanning me or feeling my belly ever said, oh, by the way, she's OP. Which would have been really good information to have, because I would have tried everything possible to rotate her and probably been more prepared for birth by, like, educating my husband and also educating myself. And, you know, maybe that would have been the thing that made me get a doula. I really recommend having a doula if you're going to try for a vaginal birth. Whether you get an epidural or not, I think doulas are good. And even for C-sections too, because I needed somebody on my team and there was nobody. So if you can hire somebody, and I would say anybody who's touching you in labor should have had their own baby first. That's my opinion. And it's not really a popular one, I guess, because, you know, there's all these people who've never had babies who are into helping other women have babies. And it's like, if you have a lot of experience and you have a true heart for women, then that might be okay. But in my case, I don't know if my doctor ever had a baby, but my nurse didn't. And it showed in how she treated me. She had no empathy for me. So there's no ability to relay how much pain is caused by childbirth to somebody who's never experienced it. There's no descriptive word. I can't even explain to my husband how painful it was. It's like, I can't ever say again that I'm in a lot of pain, because labor was so painful. And then, of course, they perforated my uterus, which was also very painful. And then in the ICU, they were pushing on my uterus that was lacerated, and that was extremely painful. And they moved me for CT while I was internally hemorrhaging, and that was horribly painful too. And all of that was like abnormal pain and related to being close to death and stuff like that. And I still couldn't get anybody to care about me. So, but my labor was horribly painful. And women talk about how, you know, when they broke my water, that's when the pain came. Or when they started Pitocin and I had stacked contraction, that's when the pain was just unbearable. And it's like, my labor started with my entire bag of water rupturing and within a couple hours having stacked contractions. So I went 26 hours having this stacked contraction kind of labor. And also my head, the head of the baby was like in the 90 percentiles. And also she was OP. And people talk about how, all their labors were fine until they had their OP baby. That was horrible, So I have to give myself credit because what I went through was very painful. And the women I know who've gone through natural childbirth, most of them had babies pointed the right way. And a lot of them didn't have their membranes rupture first thing. Or they had most of their membranes still intact, so their bag of water was still giving them a cushion. So it's like they can't understand the pain I was in because most of their labor was probably not as painful. And even though I'm very proud of women to have gone through labor and delivery, whether that be C-section, whether that be forceps, whether that be epidural or unmedicated, just getting through it is a feat in itself. And when you think of how many women have died trying to have the same outcome, it's like amazing any of us survive. So I'm always proud for women for getting through it. And, if you got through it unmedicated, that's amazing. My day shift nurse she said she had 3 unmedicated births. And I was like, when I was in labor, she was telling me this, and I was in active labor, hard labor. And I was like, I hope they respect you. I hope all your kids respect you, because I couldn't even fathom having another kid while I was in this much pain. I was like, oh my God. And that was before I got the epidural. And I was just like, I think I need the walking epidural at least. And she was trying to talk me out of it. And I was asking her about her labors, and she said, well, her hardest one was 8 hours. And at that point, it was like 13 hours into my labor, and I found out I was only 2 centimeters dilated. I was like, okay, something must be different between the two of us, Like, I'm in this excruciating level of pain. It's been 13 hours, and now I'm only at 2 centimeters. So I got the walking epidural, and then within an hour, she checked me again, and I was at 6 centimeters. And then pretty soon I was at 9 centimeters, and she rotated me around to get like my anterior lip to dilate. And then by the end of her shift at 7 p.m., I was fully dilated. But at that point, once I was fully dilated, she's like, you're going to be pushing out your baby soon. And I felt everything because my walking epidural wore off. And so I asked for another dose of my walking epidural. This is probably hour 18 or so. And they're like, well, you can't get another one because you have to wait another 30 minutes. And I just couldn't wait another 30 minutes. I was begging for this woman to shoot me in the face because every contraction was like searing bone pain into my right hip area. And I never had the indication in my mind that I had an OP baby because I just thought that's what labor was, and it was hurting me in that way. And it wasn't until the doctor checked me once I was fully dilated, and she said, oh, your baby's OP. And that's after this nurse left her for the end of her shift and gave me the 2 nurses who were very inexperienced and awful for night shift. And I had decided to get the full epidural at that point, and my day shift nurse was trying to talk me out of it and say, oh, but you're so close to having an unmedicated birth. And I said, I don't care. I already said yes to drugs, and I feel everything right now, and I'm so scared this is going to hurt. Like, I just feel this giant boulder baby rocketing through my pelvis and ripping me up. It's like, I need something. Like, this is horribly painful. Torture. And, mind you, I was able to kind of move around. I remember towards the end, though, she put me on my left side because she said baby was having a variable decel. Yeah, so took me off of hands and knees and put me on my left side. And then when these 2 other nurses came in and the anesthesia person gave me a full epidural, I couldn't feel my legs, and I was like, okay, I want to get into hands and knees. And they're like, yeah, we can't. Your legs are too numb and you can't get into hands and knees. And I'm like, how am I going to get this baby out? The doctor just said she's stuck and she's OP and I should have a C-section. It's like, I need to be in hands and knees. I can't expand my pelvis otherwise. And I even asked for like a towel to be rolled up underneath my sits bones to help like my sacrum kind of move back, and they just didn't understand what I was saying. So I was like sitting in the bed, and I had a squat bar, and I was trying to like pull up on the squat bar, and that was horribly painful. And then they would have me go on my left side because they'd see a variable decel. And then they were like searching for the baby during contraction because they had a hard time finding her and pushing the monitors into me. And I finally was like asking for the internal monitor, and they just kept denying everything I wanted, and they wouldn't let me change positions. They were like really stuck on wanting me to stay on the left side. Well, pretty soon my whole left leg just swells up like crazy, and the epidural just went to that side. So the any kind of pain relief I had quickly subsided, and then I was in excruciating pain again. And then I have this nurse just shoving monitors into me, and I'm like, this is not working. What we're doing is not working. And then, my energy's draining, and I'm getting so fatigued, and I asked for a nap, and they wouldn't let me nap. Like, tried for an hour, and they just kept talking in the room and shoving monitors on me. Asked for an internal monitor, they said no. So it's like I was in a torture chamber, and it felt like I was pushing against concrete, like nothing was happening. They tried to guide my pushing, like with her fingers up inside me, which I'm pretty sure she didn't use sterile gloves for half of the exam she did, even though I had ruptured membranes. Because she would just do it real quick, and tell me to push and to, purple push, close your glottis and push, which is the wrong thing to do. And I was finally like, I need a break. And then I ended up kicking him out. And then I did a mile circuit, turned off my epidural, started making some progress, but I guess it wasn't enough. And the OB came back in and checked me during a contraction before the epidural was back on place and said, you should just C-section. And I said, okay. Because I was just scared and stressed. And I just always beat myself up over that. Like, why didn't I keep trying? Why didn't I keep the epidural off? It's just devastating to me because I thought I could do it, and then I didn't do it. And then I ended up with a horrible outcome. And women are kind of mocked if they have unmedicated births, and they're like, you don't get a cookie. Well, they're trying to avoid the outcome that I had. Among other things. And I never got Pitocin or anything, but just having that epidural made me dependent enough to where if I didn't have a very good hospital team, I was at their mercy. And I didn't have a good hospital team. And, I couldn't move myself around. I think if I had been in a birth center, I would stay away from, getting an epidural because it would mean having to transfer to a hospital, and I wouldn't want to do that. So I also didn't touch like half of the things I brought to help me through the pain. The thing they tell you in the natural birth classes, you'll have a break between contractions and you'll be able to talk and think and everything. That never happened for me. I was in so much pain the whole time. I didn't get a break between contractions because I had bone pain and it would linger into the next contraction. Then I had a stacked contraction. So I felt kind of failed by natural birth methods because they didn't talk a lot about spinning babies or OP babies or, births that were going like mine, like where I'd have these strong contractions and not dilate. It's like, man, now it's so obvious. It's like she was not positioned well, so what I needed was to be in hands and knees and do spinning babies techniques. But that didn't happen for me. So I'm in like this constant need to birth my baby mentally because the last thing I remember, as far as my brain's concerned, the big effort that I had was trying to birth my baby. And it almost, I think, would have been less devastating had I just immediately come in for a C-section before birth even started. Instead of, like, having so much effort towards having a vaginal birth and then it failing. Because it's just so devastating. It's like, oh, I should have tried harder. But, if I heard this story from somebody else and I heard that they were pushing for 4 to 5 hours, I would say, it's okay that you got a C-section. That's kind of understandable at that point. You did everything you could, and it's like I kind of forget how exhausted I was in those moments that I made the decision to C-section. And even on the way to the OR, I was like, I shouldn't be doing this. I was still trying to talk myself out of it and just keep doing what I'm doing, which is the mile circuit, because I was feeling progress. But I just stuck to the choice of C-section, and it's like, man, I had no idea it'd be such a dangerous choice to make. I thought C-section would go smoothly. Like, nothing went smoothly about my entire process. But, yeah. I think just reading the history of birth is really eye-opening, and why OBs treat women so bad. And labor and delivery nurses also treat women really bad. And it's like, it's a cultural thing. That's the culture there. And they're used to treating women bad. And it comes from history of that's how we've always kind of treated women. And, you know, they had to compete with birth centers to get women to come to them to have their babies. And so they started doing all these nicety things in the hospital, like, oh, we'll order you food and we'll give you your own birth suite and we'll give you this and that. And slowly over time, some science has come into the labor and delivery units where they're like, actually, we could try water births. Actually, we could try TENS units and other things. But their bread and butter is surgery and medicine. You know, it's not natural. It's not like, let's try to do this the best way. Some hospitals are more natural than others. But I really wish that hospitals had natural options within the hospital. Like a birth center connected to a hospital where it's like totally natural in the birth center. And you only go to the hospital side if you start having problems. Because I think that would be the best of all worlds. And I really think that midwives and OBs need to have stronger relationships, and there needs to stop being animosity. There needs to also be, like, I agree with a lot of OBs having concern about home birth because you never know what the training is of the midwife. And there should be a standard. There should be, you know, midwives are certified nurse midwives and licensed midwives, and none of this, like, traditional midwife crap, so that you don't end up with some woman who doesn't really know any of the science, who's, like, letting all your bad signs just keep going. There should be more of a standard for home birth. But I think also there should be more natural things in the hospital setting so that you'd go there. And I think that OBs and L&D nurses, instead of like blaming women for wanting home births, they need to look at themselves like, why are we making hospital births so unattractive? Because that's really the answer. If you could make hospital births attractive, so if you could respect women and listen to them and take their pain seriously and really engage with them during their labor and try to help them through it, you'd have more women going to the hospital. So, I don't know. It's so complex. There's so many things to it. And yeah, sometimes women are going to die and sometimes babies are going to die. But, you know, they estimate that like at least 80% of those deaths are preventable. So, but you'll never hear an OB say like, oh yeah, I caused that death. That will never happen. You'll never hear somebody like take the blame for something. Like my OB, she should take the blame for what she did to me, but she's never talked to me, apologized, nothing. Like she was even supposed to be the OB taking care of me while I was in the ICU after my hysterectomy. When my staples popped, I had 2 staples pop. That's another story. And she didn't even come in. She had 2 nurses come in, take pictures, and tell them what to do for me. She didn't even come and talk to me. And I was just like, wow. Like, you can't even face the reality of what you did. You know, and it wasn't until after the hysterectomy where I found out the jada is what caused my uterus to be ripped up. And the artery was also cut in some way during the C-section. So once I learned all that, I was like, wow, it wasn't my body failing me, you know. And I think the reason why obstetrics gets to continue on like this is because you're taking care of women who are super vulnerable, who are immediately going to go into a caregiving role of an infant. They don't have time to hold OBs responsible. You know, my lawsuit didn't go well, and part of that is because I had to let it go because I couldn't find a lawyer to represent me after I lost my first one. And I couldn't really take the time to go through legal documents the way that I was supposed to. So I was constantly with my baby, and she always needs something, and she's a very needy baby, and I love her to pieces, but, you know, you can't get those 2 things accomplished at the same time. So, of course, OBs get to get away with things because their victims are the busiest people. You know, and I'm not even working. I'm just a stay-at-home mom right now, but It's just crazy. It's like, and also I'll say as a nurse too, as a transport nurse, I can't stand labor and delivery nurses. Like, I want to work in labor and delivery to help better educate myself and then also take care of women and advocate for them. But whenever I'd pick up from a labor nurse, she was always so catty and like know-it-all-y about like their little acronyms they use for birth and stuff. And it's like, okay, the only people that know your acronyms are people who work in labor and delivery, you know. And I went to nursing school like 9 years ago, so I might not have every acronym stuck in my head because it's not something I use every single day. And they would just act all like, I know something you don't know. And it's like, lady, you know like 6 drugs. There's really not much drugs to know in obstetrics. And usually if your patient's that scary, they go to the ICU. So it's like they don't even handle like the worst of obstetrics. It's kind of laughable to me. It's like, what do you guys do? What do you really do? I like, not to disrespect labor nurses, because there are really good ones, and I had a good one during day shift. But if you don't know how to spin babies, if you don't know how to help a woman have a vaginal delivery, and help her and advocate for her, and you don't know how to give TXA like my nurses didn't, and you don't know about hanging blood quickly and putting a pressure bag on, you're pretty useless, you know? And I just think, you know, all they do is back up the OB, and they don't really serve the patient. And the whole role of a nurse is to serve the patient and to protect them from the OB, protect them from hospital policy. Like, that's your job as a nurse, is you're looking out for all the harm that could happen and protect your patient from that. So, yeah. So my nurses failed me. And as a transport nurse, I picked up a patient when I was pregnant, and she was just a couple weeks ahead of me, but she was a teenager. It was her first baby, and she was in preterm labor. And the nurse was just like, yeah, she's only 0.5 centimeter dilated. She's so dramatic because she's a teenager. And I'm just like, can you just get back to staying on task with telling me the medical information? I don't need to know your bias against teen motherhood. You know, I just thought it was disgusting. It's like, she's a laboring woman. Like, let's stop labeling her as a teenager. You know, she's having this baby. Let's have some respect for her and the level of pain she's in that seems to be quite regular. Like every 2 minutes for like a minute at a time. Like, I'm looking at her like, are you sure she's not like ready to pop this thing out? She's like, no, she's only 0.5 centimeter dilated. So we get to the receiving hospital, and actually, surprise, she's crowning. And that was only like a 30-minute transport time. So I'm like, okay, so that nurse didn't know anything about how to assess dilation. And she's just poo-pooing this little girl who's trying to birth her baby. It's just awful. So, very sad. Very, very sad. And people don't even know what they're walking into when they go to the hospital. But on the natural side, I would say the natural community's kind of harmed me in some ways, because some people are like, well, you know, you have to stay away from the epidural. Like, some people are just more equipped to handle pain. And I'm like, all my friends who went natural, they've not suffered as much as me. Like, they're pansies in comparison. They don't do anything that's hard on their body. So I don't see how it's true that they got through the same level of pain unmedicated. The conclusion I draw is they probably had a less painful labor. And the evidence I have for that is my baby was sunny side up, and also my membrane structured first thing, and also my contractions were stacked. So that's my opinion. But could be that maybe they just got through it better. Maybe I was just less equipped to handle the pain than them. But either way, I don't deserve to have obstetric violence just because I got an epidural. You know, epidural should not mean C-section. It shouldn't mean, you know, you're not allowed to move around in labor. It should be that you still have somebody helping you. But you're at risk of that not working out for you. Like, if you get nurses that suck like mine, then you're not going to get to move around, and then your baby could get stuck, and then you could end up with a C-section. So, anyway, I'll stop talking for a bit.